Hello, my name is Dr. Reed Tuckson, and I am a co-founder of the Black Coalition Against COVID, which is a grassroots DC initiative and a national coalition comprised of our four Black medical schools, Howard, Meharry, Morehouse, and Drew, the National Medical Association, the National Black Nurses Association, the National Urban League, and our partners producing this show tonight, blackdoctor.org. On behalf of my colleagues at the Ad Council, the COVID Collaborative, the Joy Collective, Choose Healthy Life, and NFL Alumni Health, we are all so excited to welcome you to our end-of-year town hall that we are calling Real Conversations on Protecting People Against COVID-19. We've worked hard to provide you with an hour of stimulating conversation, sharing motivating stories and compelling short videos, and providing you with science-based information from trusted professionals. All of this designed to help each one of you make personally appropriate choices for yourself, your family, and for our community in the context of this persistently deadly COVID pandemic, which has exacted a disproportionate toll of death and suffering in the Black community. The good news and the challenging news for our conversation tonight is that this holiday season provides us with many more options to choose from than we had this time last year. We now have plentiful availability of free vaccines that are now approved for everyone 5 and above. We have boosters that are able to extend the effective life of previously administered vaccines. We have monoclonal antibodies that can minimize the effects of COVID after infection, and now the promise of new pills that are demonstrating effectiveness in previously infected persons. And we have now the availability of home-based testing. I am so pleased that we're joined tonight in our conversations by two extraordinarily expert physicians. With me tonight will be Dr. Cindy Duke. She is a specialist in virology, and she is unusually also an expert on fertility as a obstetrician gynecologist. We also have Dr. Chris Purnell, who has really distinguished herself in providing trustworthy information on COVID to the Black community. She is an ambassador for the American College of Preventive Medicine's Vaccine Confident campaign. So let's get right to it. We've learned that sometimes it's not just about the facts that determine how we make decisions, but also our fears, our emotions can be determinant in how we interpret and act on facts and medical guidance. So let's begin our conversation tonight with our first short video from the Ad Council's new public service announcement series that they call Do It For Me. Let's take a look.
Because I care. I want you to be safe. If you was to die, man, that would literally kill me, man.
If it made you feel that way, bro, I'll probably do.
Oh, man. Love you too.
Well, let me bring into the studio, I think if they are here yet. Do we have Amir, Akeem, and Wesley yet here? The featured brothers in that video? If not, then Dr. Purnell, one of the things that I noticed about that short video is the sense that this conversation between two brothers. Oh, and here they are now. And so I do see Akeem is here. Akeem is here and his brother will be joining shortly. But Akeem, I noticed there this sense of emotion between you and your brother. At the point in which that was filmed, as I understand, your brother was not vaccinated, and it was clearly important to you that he become so. Why were you so adamant and so emotional about that?
He had his own reasonings, several reasons that he had that, it wasn't FDA approved at the time. And a lot of people were getting sick from taking the vaccine. And so, but the percentage between people dying from COVID and people getting sick from the vaccine is drastically different. But he was just so caught up in not FDA approved. But then on the news channel, I saw somebody who had COVID and he was begging the doctor to give me the vaccine. And the doctor says, I can't cure it. It's not a cure, it's a preventative. But you already have COVID, so there's nothing I can do. And so that was what really impacted me. Is like, that scared me a little bit. I wanted to get my brother to go get his vaccine.
How hard, and let's just be real, because that's what tonight is. It's a conversation about being for real. Black men have a hard time with emotions and especially expressing love to other Black men. How difficult was it for you to have that conversation and to be that transparent about how much you cared about your brother and how much it would hurt you if you lost him?
It was hard. It was definitely hard because he was making valid points that I could hardly argue. You know, who could, if it's not FDA approved, that's a realistic fear. Like, that's a realistic saying, I don't know what's in it. And but I was past all that, people dying and stuff like that. I was past, like, look, man, you gotta be safe because you can get it and you end up in the hospital and be in the same situation as that other guy was. And that guy was healthy. He wasn't, there was nothing wrong with him. But he got COVID and things went the other way, unfortunately.
Yeah. Well, let me ask Dr. Purnell, now that things are approved, are there reasons that anyone would have to be concerned today about whether or not these vaccines are not only effective, as we are hearing from Akeem, but also safe?
Thanks for that question. First off, let me just say, Akeem, I salute you and I thank you for your courage, because it takes courage to speak from a place of vulnerability. And your story resonates with me because I lost my dad. I lost my dad in this pandemic, and my sister is a long COVID survivor, and I've lost 2 cousins. And I frequently had conversations with other family members or other people in community about, I don't want my story to be your story. Right. And so helping people to understand just how enormous the amount of data that we have to prove and to argue conclusively that these vaccines, which are available in the United States, are not only safe, but effective. So Dr. Tuckson, to your point, there is no identifiable patient population that you would say you should not get vaccinated. There even is debate now among those who have a known allergy to ingredients. Should those persons be vaccinated under close guidance of a physician in observation, or should they refrain from vaccination at all? So outside of that debate, and outside of someone who has a known allergy to ingredients in the vaccine, or had anaphylaxis or allergic reaction to, let's say, the first dose in the series, those would be the only people. Otherwise, if you have high blood pressure, if you have diabetes, you should get vaccinated. If you have asthma, if you're struggling with overweight and obesity, you should get vaccinated. If you are breastfeeding, you should get vaccinated. If you are a person who is pregnant or considering getting pregnant in the future, you should get vaccinated.
Perfect. So Akeem, how did your brother, it's like, what happened off camera when the cameras turned off, and here you are putting your heart on your sleeve right there in front of, by the way, who's the older brother?
I'm the oldest brother.
Okay. So you put well, you always have to, I'm an older brother, and I'll tell you, but my brother, I got to take the lead, he's going to kill me for saying this out loud. But and he's bigger than me too. So, but Akeem, how did he react off when the cameras were turned off after the hug? What was your conversation about?
First and foremost, I want to say to Dr. Purnell, I'm so sorry for your loss. My brother couldn't believe that I cried. He's like, whoa, like, you took it that far? I'm like, man, it's real for me. Like, a lot of people go because they're in front of the camera and it's fake. That conversation between me and my brother was real. Like, I was feeling that way. There was no, someone didn't spray anything in my eyes and told me, okay, there's tears. No, I really felt that, and the director asked me, what's your greatest fear? And that was it, losing my brother. And so I turned to him and I told him what my deepest fear was. It's like, man, you my other half, man. Like, me and my brother are close. Like, we shared everything, shoes, clothes, bed. That's how it was. We didn't have the luxury of our own room. We didn't have that.
Where'd y'all grow up, man?
Huh?
Where'd y'all grow up?
we grew up in LA, Los Angeles, and single family mom. Mom did everything, worked 3 jobs, and went to school. And so she's the epitome of hard work.
Is she still with you?
Oh yeah, we're gonna see her in a few weeks. Go out there to San Jose.
What was her reaction to all of this, and what was her reaction to you being vaccinated, but your brother not?
My whole family cried when they saw it. My mom didn't know I was doing that, so when it came on TV, she was surprised, like how my entire family was surprised, and she cried. It was like she called me right away. Is that real? Wow. I'm like, yeah, that's real, Mom. Like I want you to get the vaccine. And my mom ended up getting it. My whole family was affected by it. My cousins ended up getting the vaccine because they thought I was acting, and I was like, no.
Wow. Dr. Purnell, one of the things that Akeem said that influenced him, and I wonder what your reaction is that there are people, and we hear stories of this every day, of people in the hospital on oxygen, deathly ill, and then saying, okay, can I get the vaccine now? What do you think about that? And how often do you hear those stories?
Doc, it's heartbreaking, right? It's really heartbreaking for me because we in public health, we in medicine more broadly, we have to become more expert at the lived experience and communicating to people in language that they can understand, with stories and narratives, elevating the stories of people who look like the communities that we serve and that we come from. And so that's my first reaction. It's heartbreaking, but it's also frustrating because there's a fair amount of misinformation out there, and people have legitimate, let me emphasize this, legitimate and valid fears and concerns. Okay. On top of those legitimate and valid fears and concerns, you then have this misinformation, a little bit of truth mixed up with some things that are not true. So people aren't sure. And so that complicates the decision journey. So as much as we can, we have to speak in direct, plain spoken terms so people know what they're facing. And I can tell you, when I got vaccinated because I was enrolled in a trial. And when I made the decision to enroll in a Moderna COVID-19 vaccine trial at the time, my family's first question is, why? You don't need to do this. We just lost our dad. My oldest sister is a breast cancer survivor and had long COVID. She was struggling to go about her day to day. So I think being able to elevate those stories and to help people understand the why, of get vaccinated, we have to do a better job around. And yes, I do, unfortunately. I hear from patients, I hear from people in community who wish they had made a different choice. But even elevating that story can interrupt that possibility for someone else.
Akeem, one of the things that you said early on in your conversation with us was that back in the early days before the FDA approval, getting the authorizations and so forth, and some people not fully understanding that this vaccine was safe and effective. And by the way, I see now that Dr. Duke is with us, and we'll join her in the conversation in a moment. But Akeem, now that we know that there are all of these facts that prove safety and effectiveness and so forth, but there's still a lot of misinformation out there in the land. Do you, in terms of as you travel around in your social circuit, do you find that there is still a lot of misinformation being spread? And does that have a significant impact on the decisions of people in your social circuit about whether that they will become vaccinated or not?
Oh, misinformation is deadly. Because, you can lose your life over misinformation. I mean, they're saying that, some of the vaccines, you put it in your arm, it has that little metal thing or some kind of magnet that if you put your spoon to it, it'll stick to your arm. There's stories about that. There's stories about all the vaccines making you have blood clot. There's information about the droopy lips, the lips going to the side like that. There's so many stories out there, and so it spooks people, and it's crazy. Not a lot of people do their research. What it is people listening to other people, or people listening to the media, the news, or something. They'll see something instead of going like, "Oh, let me go research that and see if it's true." They'll take it, run with it, and then when their life's in jeopardy, then it's like, okay, all that stuff's out the window. Give me the shot, but it's too late, so it don't work.
Wow.
And it's
Dr.
crazy.
Duke, Dr.
I'm
Duke,
sorry.
you know, this issue of misinformation that Akeem describes is unfortunately so prevalent in our community. What's your reaction to that when you hear this kind of information? Oh, take yourself off mute and we'll be good.
I really agree with Akeem that misinformation kills. And in fact, especially in our communities, we're seeing large numbers of people succumbing to COVID-19 when they could have otherwise prevented a lot of these bad outcomes if only they had the right information. So I'm glad that you highlighted some of those myths, Akeem, because indeed, there are no magnets, there are no chips, no tracking chips in any of the vaccines. There are no special things meant to cause infertility or meant to cause children not to learn well growing up. I think there's a list that's circulating, for example, of supposed ingredients in the vaccine. And those, of course, are not true. So, these so-called poisons are not in the vaccines. And we absolutely would not be here talking about vaccines if we thought there were ingredients in there that were not compatible with safe human existence. And I think it's important for people to understand that. I think when we talk about doing research, that's where also a lot of people are coming up in the misinformation circle without knowing they're in a misinformation circle, because they do believe they were doing their research. But of course, when we talk about doing research, we're talking about using credible sources. And that, of course, has been part of the issue. Is historically our credible sources that we tell the community about would be the CDC, the NIH, and other vetted, trusted organizations. But there's been an active misinformation campaign to undermine confidence in those very much vetted organizations, the WHO, the World Health Organization. So part of the conversation is first debunking some of the myths, debunking the myths that say the CDC is giving inaccurate information, explaining that this pandemic has been rapidly progressing. And so we've been gaining new information. So what we may have told you about the pandemic in March of 2020 and what are your safety steps that you need to take may have evolved over time, but they were not lies to you by these organizations.
That is such an important point. One of the things you see in the news is people attacking Dr. Fauci because the things that he is being able to talk about today may be slightly different than the very early days. So that's because you learn, you grow. That's what scientists do. And you, as an expert in virus diseases, when the comments that you make have great weight. Well, Akeem, we owe you, my brother, a debt of gratitude because, as I mentioned in the setup to this section of our show, sometimes it's about facts, but sometimes it's about emotions. It's about fear. A lot of things come into the complicated calculus of how we make decisions and choices. You have allowed us to see a strong, proud Black man who is not afraid to be vulnerable, who's not afraid to shed a tear when it comes to his love for his brother. And I would have to imagine, Akeem, that love extends beyond just your own immediate family to Black folk in general and all people in general. And so I think you've given us permission to say to each other during this holiday season, I care about you. I know I'm going to call my brother tonight, and I'm going to take the opportunity because nothing is guaranteed for us. And I'm going to call my brother tonight and tell him I love you. And I think that's something that, is kind of, I'm going to do it. Akeem, you have taught me something about Black manhood that we needed to hear. Thank you, my brother. And we appreciate it. Tell your brother, by the way, your brother is now vaccinated.
Yeah, my brother's now vaccinated and he's happy that he did because some of his coworkers had got the COVID-19 and, they're struggling with that right now. So he's like happy that he got it.
Hey, man, thanks for joining us and take good care.
Thank you guys so much. I appreciate the opportunity.
As we continue our conversation, already the issue of fertility has come up a couple of times. And so let's explore this very sensitive issue. And to start us off, let's play our next Ad Council video.
Hi, I'm Dr. Cindy, and I'm here with Asha. What would be the thing that makes you say, you know what, now's the time?
I've been on the fence for a while about whether to get the vaccine or not, based on, things that I've heard, things that I've seen. Seeing those kind of things just gets you a little scared. It's like, I think everybody should have a choice. Could the vaccine possibly affect my ability to have kids in the future?
Here's the real kicker. If someone got COVID-19, the illness, and they were pregnant, their chance of miscarriage goes up by over 3 times as much.
I didn't think about COVID-19 possibly affecting your reproductive system, because my mom, she was barely able to have kids. It was a miracle that I was able to be here. It was very important for me to know that, and now I am a lot more secure in getting the vaccine than I was.
Wow, that was extremely powerful. Dr. Duke, tell us a little bit about Asha and what it was like having this conversation with her.
That was a really incredible conversation. Asha is a recently graduated high school student. So she graduated in the summer of 2021. And she was actually very much aware that we're in a pandemic. She was aware that people are dying from the pandemic. But in terms of thinking about it, she thought, if we stay at home, if we have enough food, we're okay. And, even though recently she graduated high school, she's been getting out, mixing with friends, etc. She hadn't really thought about what could be the risk to, in her case, her mom, who lives at home, who has a number of underlying medical conditions, and what would be the risk to not only Asha if she were to become positive with COVID-19, but what might happen with her mom, who is her breadwinner and person she lives with. So we talked about that, and she said, yeah, I hear that too. So that's really what we talked about. 3 big things. We talked about, what does COVID mean for her, and by extension, her mom who lives at home, and what would that look like if one of them became sick, whether it was Asha or her mom. And the second was, what would that look like in the long term in terms of risks to her own fertility, risks to her future ability to carry a pregnancy if she were to develop COVID and some of the long-term conditions that can follow COVID-19, like poor heart function, poor kidney function. And as we talked about that, she remembered that her own mom had struggled with conceiving her, Asha, and how difficult that was. So we talked about some of the things that I've been seeing and what we're seeing around the world with pregnant women who are positive. And that was what did it for her in terms of convincing her to consider getting the vaccine.
Before I come back to drilling into some of these issues of fertility and giving the science of that, let me turn to Dr. Purnell and ask you to sort of comment on this first theme that Dr. Duke presents, which is a sense that Asha has a responsibility to other people, not just to herself. One of the things I find so frustrating, Dr. Purnell, is this sort of sense that people are sort of looking out, just thinking the whole world is about them, and not remembering that with this kind of disease, we're interconnected with everybody.
Yeah, because unfortunately, in our society, in our world, we think about the individual far too often than we think about community. And increasingly, when I have conversations, I frame it only in the context of community. And what I mean by that is we all breathe the same air. Coronavirus is an airborne respiratory illness, is a multi-system inflammatory process. And so your choices, your actions as an individual impact the next person, whether or not they want them to or not, because we share space and we share air. And increasingly, I want people to understand not one person can beat back the pandemic. It has to be the collective choices, right, of populations more broadly and widespread in order to beat back this pandemic. And the final thing that I would say about that is to preach about the power of community, to preach about all the examples of when community has come through. The power of community, whether in our histories, whether in abolition, whether in civil rights, the power of community in the scientific community to get us to a solution that is safe and effective, and the power of community of getting to higher ground. And increasingly, that's the conversation that we have to have. And I'll end with saying, when I lost my dad, it wasn't just my loss, it was a loss to this entire nation.
Let me just ask you, Chris, to Dr. Purnell, to just extend that just one more step. And I wonder how you would react to the notion, if we think about the protests of Black Lives Matter, and we have all of our people just legitimately upset and concerned about whether we live or die. Is it morally possible to be a Black Lives Matter advocate and not be vaccinated, or at least if you're not vaccinated, to wear your mask when you are around other people? How do you respond to that kind of community?
I think it's misguided, right? I think it's misguided to advocate for our brothers and sisters and to advocate for their freedom and their well-being, and not to do the things to keep us alive in this pandemic. Look, there are many pandemics that have snatched our lives. The pandemic of systemic racism and the collision of systemic racism with coronavirus. So if you're going to be an abolitionist, right? If you're going to be a modern day abolitionist, if you're going to be a freedom fighter, you got to know what you're fighting against and what you're fighting for. So I would challenge, and I consider myself a justice warrior. So I would challenge those of us who are saying that, I'm advocating, I'm standing up for the right, for the humanity and the well-being of community, Black community in particular, to say that ending this pandemic is a part of that fight, because we have borne a disproportionate burden of this monster. There have been earthquakes of devastation in Black and brown groups. So you can't love Black and brown groups without fighting to save our lives from this pandemic.
And Dr. Duke, one of the things that was really compelling about Asha's story is the sense, as you indicated a moment ago, that her mother struggled to conceive her. Clearly, this young woman respects her life and wanted to make sure that she protects her life, but does not infringe on her ability to also procreate life. Can you give us, again, in a straightforward way, what are the facts about the vaccine and how it can or cannot affect our ability to conceive? Does it affect our DNA? Tell us the facts so that we can make sure that at least people are making decisions based on true scientific-based information.
Absolutely. So I think the first thing to emphasize, especially when we're talking here in the United States, but also across the world, is every single available COVID vaccine candidate is safe in that they do not integrate with your DNA. They don't change your DNA. They don't change your cells. They are not going to transform you in any way in terms of what your structure is. That's important to know. Secondly, is that the COVID vaccines have been rigorously tested and studied in terms of their safety when it comes to fertility in people with uteruses, ovaries, those who identify as women, non-binary, and also those who were born with testicles. It's important to emphasize that, which is a stark contrast from what's happening in someone who's unvaccinated who gets COVID-19, where we're seeing high rates of miscarriage, high rates of hospitalization, high rates of stillbirth. Sadly, we've all seen the stories of Black women who were pregnant, who succumbed to COVID-19, who were unvaccinated and succumbed either shortly before birth or shortly after delivering their babies here in this country. And so it's really important to recognize that COVID-19 poses a direct threat to someone who's pregnant or someone who's trying to conceive. Secondly, getting vaccinated not only protects you against this risk of premature death while pregnant or needing to be in the intensive care unit. In fact, if you're pregnant and contracted COVID-19, especially if you're not vaccinated, you're 70% more likely to land in the intensive care unit requiring a tube to help you breathe while you're pregnant. And so vaccination is really important for saving and safeguarding the person who's pregnant. But also those vaccines help to protect the yet to be born child. So if you're pregnant, the vaccine actually prepares your immune system. The thing that most people aren't aware of is that when a baby is born, its own immune system isn't yet mature enough for the first 6 months. So it's actually relying on any immunity it got from the person who was carrying it, its mom, before it was born. Getting vaccinated means your immune system can cross the placenta, become part of baby's own circulating immune system, and protect that baby for the first 6 months of its life when you're possibly getting exposed to other people. And of course, breastfeeding, lactating, producing milk also helps to protect the baby. But it's not the same as if that antibody crossed the placenta while you were pregnant. And so we really encourage, if you're planning pregnancy, get vaccinated. If you are pregnant, get vaccinated. It's safe, and it's safe for your baby, and it's definitely going to help protect your pregnancy in the long run.
Let me remind our audience that this guidance, which is very different from the nonsense that you may see from Pookie on the internet, is being given to you by a woman who has dedicated her life. She has a PhD in virus diseases and is a fertility specialist. She's, I think, the only physician that I know in the country who is both. And so this lets you understand, who do you trust, Pookie on the internet or Dr. Duke, who has spent a lifetime studying both of these issues. By the way, in your conversation, Dr. Duke, with Asha, you started out with, now is the time. Why did you say that?
You know, I think for a lot of people, they've been hesitant, and we understand it. We ourselves would admit that initially we wanted information before we read up and decided if we're going to get the vaccine. I certainly went through all the data that the FDA had put online to decide for myself, is this safe, and am I going to go out there and tell people about its safety? And so what I asked Asha was, in response to her having shared with me that she was actually really eager to explore her community. She was pursuing a career in acting and also going to college. And so I said, you know, well, now that you're out and about and not just going to school from the house, what are the things that you think would help you understand the importance of vaccination for you? And I think that's what every person has to ask in the end, is what will it take for you to be able to make that decision for you and your family? Is it about your bottom line, whether you can afford to keep your household going? Is it about who will take care of your children if you became incapacitated? Who would watch your kids? Who would pay the bills? Who, if you're a farmer, who's going to watch your livestock? Are you going to be able to sell your livestock if it's discovered that you are ill and on the farm, you know? And so it's really important to ask yourself, what are your personal questions here, and get those accurate answers.
And now is the time. Real quickly, Dr. Purnell, we have a question from the audience that asks, is it important for people who have already had COVID from being infected, should they get vaccinated as well?
This is an emphatic yes. And we know we described previously how data is evolving and growing and accumulating daily. So we know that people who have had prior history of coronavirus, they have a natural immunity, but that natural immunity most likely isn't as enduring and does not cover the expanse of potential variants that the coronavirus will continue to mutate and change into. But once a person who has had coronavirus gets vaccinated, they have something called hybrid immunity. And that hybrid immunity provides robust, even muscular, if you will, protection against reinfection, which we already know is rare, but in particular, reinfection with a new variant that may behave differently than the original strain of coronavirus. So, like I said previously, there isn't anyone that I can think of that falls in a group that says, hey, you shouldn't get vaccinated. So if you've had coronavirus, get vaccinated.
And as we well know, there is a new variant that is spreading around the world called the Omicron variant. And your point is really well made. Well, Dr. Duke, you could not have teed up better our next segment, because you talked about farmers and people that are on the farm and being able to make decisions. And of course, this is also the holiday time, and holidays are all about families, family values. And so we are lucky enough now to have another video that features two important guests for us tonight. Craig Thomas, who is the owner and CEO of CJ's Produce, and Leslie Weaver Thomas, who is Director of Operations for CJ's Produce. They live in rural America. They are involved in farming, and they are very much family. Let's play that PSA.
The CEO of CJ's Produce. I'm the muscle, she's the brains.
It works.
My great-grandfather has owned the Brantley Estate since the early 1950s. It has stayed in our family, and we're trying to make him proud.
We had plenty of food and love, and that's what got us where we are today.
Mama Tia is my grandmother. She was actually the first in the family to get vaccinated. I was afraid. Leslie was going to get the shot. I came up with every excuse anybody else would say. My grandmother got her shot. When I saw how strong she was, it was like, I'm a healthy young man. Why can't I?
Did I have reservations? Absolutely. But doing your research, weighing the options of what works best for you, getting the vaccination is helping your fellow brethren, regardless of how you may disagree with them.
CJ has been the motivation for a lot of things. He needs his father there to show him how to become a man. So I am fully vaccinated. I have somebody counting on me, so we made the leap.
My goodness gracious. Let's bring them into the show, please. My goodness. What a family you are, and the love that you have as a family just pours through. Craig, let me start with you. And I'm very struck by this comment that you make, and every Black man in the audience has got to be affected by it. People are counting on me. Talk about why you said that and what that feeling means to you in the middle of this COVID pandemic.
Well, my son, of course, I'm his hero. So I have to be the strong person to, at least lead by example. And I have to at least be here. And, I wasn't going to allow COVID to be one of those things, be a factor in me not being here. And of course, with my parents being older, somebody has to watch after the new children. So, I had to do what I had to do to make it happen. So,
and Leslie, in terms of family values, let's talk a little bit about what does family values, how does that conversation intersect with the fight against COVID?
Family values for me is a balance. It's to be healthy, not just spiritually and within our social circle and within the household, but healthy as a physically in our body, and making sure that we're setting the example to be around our colleagues, to be around our community, to be with those who's receiving produce from us, to be sure that we are not spreading or being a part of the problem, but setting the example and taking a risk, and just making sure that we're all around, that we're in good health.
Dr. Purnell, I'm going to turn to you because there was a very important theme that emerged from watching Craig and Leslie, and that is we've got plenty of food, and you could tell that food is healthy. I mean, it's right there. There's no fooling around with these folks. I'm so jealous when I saw that. But it's obvious that Craig and Leslie are taking care of themselves. There are a lot of people, Dr. Purnell, that I talk to on a regular basis who say, hey, I'm eating right, I'm sleeping right, my immune system is up. Why do I need to get vaccinated? Because I'm doing all the right things. What's your response to that kind of thought process?
Right. Coronavirus is a formidable opponent. There are, unfortunately, stories of those among us who have no history of chronic health conditions, those among us who have been young, even marathoners, very physically fit, and they got exposed to coronavirus, and either coronavirus left them with long COVID or coronavirus robbed them of life. And so I tell people there is no safe way to beat coronavirus other than doing what you need to do, and that's keeping yourself protected. It's not, I've had people say, Doc, look, I'm going to continue to exercise. Doc, I'm going to continue to eat well. But you need to do more than that. You need to mask whenever you're in public indoor spaces or crowded outdoor spaces. You need to get tested if there's a risk of exposure or you've been on a recent trip, and you need to get vaccinated. So that's the way to ensure that you can be healthy and that you can be well, so you can continue to eat that good food that my brother and my sister are doing. Like I admire farming. I come from a family of farmers. I got a shout out our Clarksville, Virginia. So that's what we got to do in a very wholesome and holistic way.
You know, Leslie, you mentioned that you were at first afraid. You had your fears and your doubts, and then you did homework. Talk about the process that you went through that got you from a place of hesitancy to a place of action.
Just really doing my research, listening to the news, listening to different news conferences, as well as even going to the CDC website, getting information from the source, even just checking with my doctor, looking at some of the ingredients, checking myself. I just recently received a physical not too long before COVID came out. So just making sure that I was healthy enough to receive it, going to my local health department as well, and using resources in my community. So really kind of looking at the odds. I work with people every day, so I didn't want to be out there around other people and, they come to a program and they leave and say, oh, I have COVID, and that be the source of that. So I just wanted to be sure that it worked for me, just which shot was the best one for me.
Dr. Duke, I would have to imagine that you are overjoyed by the sources of her information as opposed to, she didn't seem to list Pookie on the internet.
Right. She didn't list Pookie. She didn't list the WhatsApp aunties.
No.
It's important to vet the sources of information. And while Pookie might be a great source for a local stylist or a good restaurant, when it comes to your health, when it comes to vaccine, when it comes to your COVID information, you have to go with your vetted sources, which Leslie, you said all the right ones, which is your personal health professional, your physician. That's your go-to person. So not Pookie telling you have an allergy, is you going to talk to the doctor, going to your local health department, your county health department, your state health department, very important. Going to the CDC, the National Institutes of Health, the Food and Drug Administration, the World Health Organization, the NAACP, blackdoctor.org. Sources like that is where you should be going, not the random blog, not the random person because they have 1 million views. That is not vetting and verifying information. It's simply more people open the video. It doesn't mean the information is accurate.
Absolutely.
And Craig, let's be honest as brothers. Overwhelming majority of us, we get our guidance on health from our ladies. Let's be honest. I guess that was your case too, huh?
Well, not just Leslie, but my own mother told me I was not allowed to come back if I didn't go get vaccinated. So that was another main reason in me being vaccinated.
Well, with that, how are you guys going to handle the holidays? Big family gatherings. Have you thought about how to make sure that your child is safe, that your mama is safe during the holiday period? Are there rules that you all are going to follow?
We are blessed enough to be a part of the family that everyone has been doing their research and they pay attention to research. We've taken the proper precautions, having events outside, making sure windows are cracked, wearing a mask. We actually got invited to a wedding this holiday, and vaccinations cards are required. If we're going in big space, we double mask. So just really being sure that we are being extra careful, because we want to return home safely and we want to be able to make it back to work and make it to our community gardens and to our plot safely and to continue to do what we need to do. So we are taking proper precautions.
Dr. Purnell, what grade would you give this family, and how did you hear that?
Look, I'm a public health professor, and you got my heart. she's A plus. She's A plus. So I appreciate that, Leslie. And I think what's so impressive about this story, about your family story, is that each of us can take the time and take the effort to learn. If you have questions, if you have fears, if you have concerns, learn and go to those credible places and credible persons to get the right information, and then spread it, because that's what I also hear that your family is doing. So A plus.
And I may add, I think one thing to plan for the holidays is make sure you get boosted. So not only are we talking about vaccination, but for those who are eligible for booster shots, now's the ideal time to get your booster. Go get your booster this week. as you're planning for those late December holidays, your immune system is going to be nice and ramped up and ready to mingle while doing everything else that Leslie just described, wearing your mask, doing the outdoors, ventilating as much as possible. Get that booster.
One of the interesting phenomenon, I was just reviewing the data today, that because of the Omicron variant, the number of people getting their boosters over the last week has skyrocketed. This has been an interesting phenomenon. And so if you're somebody who has already gotten their first 2 doses or their first dose of the J&J, absolutely don't get left out. Get your booster now so that, as Dr. Duke has mentioned, you'll be ready to go for the holidays. And by the way, those of you that are going to be spending time with your family during the holiday, start now to protect yourself by not being indoors, in bars, in places where you want to try to keep yourself as clean as possible, so that when you get where you're going, that you will not inadvertently be spreading, particularly with this Omicron variant that is now we're finding all around the world and is already here in the United States. And I think Dr. Purnell's point earlier is a very important one to emphasize. Let's don't forget how this virus is spread. It is airborne. You cannot see it. You don't know that person beside you, whether they have it or not. There's no way to tell. And so you have to protect yourself and you wear your mask. Well, as we finish this segment with you all, Craig and Leslie, if you would just look straight into the camera, what is your guidance and advice to people like you who are listening tonight?
I guess people like me or like us, do what's best for your family. Don't always think about, I think like the one doctor said, what everyone else is saying or what the social media is saying. Do what's best for you. Truly weigh out all your options and protect yourself at all costs.
Wear your mask and wash your hands.
Well, brother, you got the last word on that. Hey, listen, Craig, and maybe Leslie, but even though you're going to be off camera in a minute, you definitely want to stick around for the last segment, because I got to imagine that you're a football fan. And joining us now for our last segment, right after we play a very interesting video, is that we are really blessed to have 3 football icons, names that are so well known, Hall of Famers, who are also NFL alumni ambassadors. Chris Carter, Rod Woodson, and Will Shields will be with us in just a moment after we play the next video.
I'm Pro Football Hall of Famer Will Shields.
I'm Chris Carter.
I'm Pro Football Hall of Famer Rod Woodson.
I'm Jerry Rice.
Like in football, it takes every individual doing their part for the team.
Now we're trying to secure another important win, ending the COVID-19 pandemic. You may have questions or concerns about getting vaccinated.
I encourage you to talk to your healthcare provider, get the facts.
I encourage you to talk to your healthcare provider, get the facts, and make your decision today.
Getting a COVID-19 vaccine helps protect you, your family, your friends, and your community.
It's been a long fight, but we are in the red zone now.
Let's win as a team.
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 Wow, that is real leadership by these icons. And let's bring them in into the panel. And I see already Chris is here. Chris, let's start right with you. And I see Will as well. But Chris, let's start with the notion. There are many high-profile celebrities like you who have been somewhat reluctant to speak up, to poke their head up and make a definitive statement. Why have you taken this on so seriously and so publicly? You might want to take off your mute. That would be good.
I think that the pandemic and Doc, greatly appreciate you guys having me on. That just like your playing career, you can either lead for good or you can lead for bad. And I've always tried to be a positive leader. I had questions just like everyone else had, but when you look at it and how am I going to protect myself, protect my health, and protect my family, That's the reason why not only I got the vaccine, that's one of the reasons why I asked a lot of questions, but it's also the reason why I would lend my voice to let people know that yes, a lot like yourself, I had a lot of questions, but if you want protection, this is the best protection out there, coupled with being safe, washing your hands, wearing a mask, staying in open air places. Those are all the things that will get us through this pandemic that we basically have been battling for 2 years.
Wow. And Will, as we also ask you the same question, but you are, as we mentioned, an ambassador for the NFL Alumni Health. Can you talk a little bit about what NFL Alumni Health is all about and how you found your way at this stage in your life to being an ambassador for health?
Well, being an ambassador, first of all, thanks a lot for letting me be a part of this segment. But being an ambassador of health is one of those people that you're trying to help others understand and give them the access or understanding of what places to go to find information. And for us, we basically try to fill and talk to as many people as we can on a regular basis and give them access to where to go find the information to help them make the best educated decision. And, you know, it's not our job to make the decision for them, but it's our job to give them the opportunity to find out the correct information on what's going on. And what's really interesting about it is there's always that fear of understanding. And the more you can get, the more information you can get, the better you can make those decisions. And for me, it was one of those things that, of course, my daughter is in the medical field. And so she's constantly, you know, telling us new things that's going on and trying to educate us on how to get everything put in place. And I think that's one thing that's very important, to understand all the different nuances and always have multiple sources so that you can sort of cross-reference and make your comfort level go and understand where you're going to do and what shots you want and what things are going along. For me, with me being a type 2 diabetic, it was one of those things that I had a very big fear of what could happen. You know, and also just to protect the family as I started to look into different scenarios of getting COVID vaccine.
And Rod, thanks for joining us as well, Rod. And let's just ask you the same question we've asked your brothers. Why have you decided to take this issue on? And so many other high-profile folks, and Lord knows your profile is very high in this country. Why did you decide to take the risk of speaking out and being a symbol for getting vaccinated?
Well, I think we all need to do our part. And, you know, we've heard of the Spanish flu and the pandemic and all that back in the day, but this is our current pandemic that we're living through. And I didn't want to be the person to not do my part when it comes to vaccination, getting educated from my doctor to seeing if what I should do, how I should get vaccinated, what vaccination shot I should get, and being a part of that. And you know, we all in my family, outside of 2 of us, got COVID. And my daughter's boyfriend, her father passed away from COVID. And
oh, that was, did we lose Rod there for a second? All right. If so, we'll come back. That point that he made, I mean, that is so emotionally compelling, Chris. And one of the things that, let's be honest, because this is a conversation for real talk tonight. So many Black men have been caught up in this misinformation deal and some kind of a perverse sort of macho thing that says that I'm not going to get involved with this. What are you saying to other Black men about our responsibility as men to ourselves, our families, and our communities?
I'm telling them the story of my father, Dr. Tuckson. I start there. My father was a proud Black man who overcame so much. My father survived chronic HIV infection. My father was surviving severe emphysema and had even been diagnosed with end-stage lymphoma. He was a bionic man. He kept on ticking. My father was actually in the hospital awaiting placement for rehab to come back home. And he got exposed to coronavirus. And I'm saying to my brothers, make the choices and the decisions that my father didn't get a chance to make because he died so early in this pandemic and lost his life. I tell people, look, I was working at one hospital in Newark, New Jersey, and the day that the Army reservists showed up to shore up my hospital, my father died in another hospital 4 miles away from me. I had just gotten permission. I raced over in my car. As soon as I got in the parking lot and I turned my ignition off, I got a phone call, your dad died. And so my father's story, I hope, becomes fuel for another Black man to do what he needs to do to not just protect his life, but to protect his household, to protect his family, and to protect his community. That's why I cannot emphasize enough how important it is for my brothers on tonight. And I love the NFL to be amplifiers, because I see you all as megaphones. You're megaphones to make that informed choice. And the more that we can communicate that brother to brother, the better the whole will be.
And Chris Carter, what is your answer to that same question?
I think that we all have a responsibility, whatever nationality, whatever religion that we have. But I just think it's important for people to, whatever neighborhood or whatever community they're a part of, try to have an influence in that community. So I think for people like Will, who I have a great deal of respect for, and people like Rod, I competed against Rod since we were 18 years old, and he went to Purdue and I went to Ohio State. So these guys I have a lot of respect for, and I respect their opinion. But also we have 1,800 younger players in the NFL that they were looking for advice. They were looking for role models. So for me, not only my family, but for the guys that are currently playing the game, we wanted to be a great example to them that, yes, we can do this. We can do it together, and we can help the country come back, because football is a huge part of that. So not only being an African-American role model, not only being a gold jacket and the NFL legacy player, I just think being a good steward in your community is very, very helpful as we try to move forward and out of this pandemic.
And I'll come to Will for the last comment from him in a second. But Dr. Duke, I wanted you to comment on, Will was very honest and open about the fact he's got diabetes, and he's, that's clearly in his mind. What do you say to people out there who have diseases like diabetes and other pre-existing chronic illnesses in terms of how that relates to their decision personally to be vaccinated?
Yeah. I say listen to the information that you know to be true about your health. I think many people are out there making decisions about their own lives based on other random people's words and language. And the truth is, we know what the risk factors for severe COVID are, and it includes chronic underlying conditions like diabetes, high blood pressure, autoimmune illness, asthma, smoking, but also just being overweight. And the truth is, up to 30 to 40% of us don't know if we're diabetic, don't know that we have high blood pressure. And so it's not enough to say that I'm sure I'm healthy because I feel like I should be healthy. It's know your real health status, but be honest about your truth. And your truth isn't your favorite radio host's truth. It's not your favorite Fox News host's truth. Your truth is go get yourself checked out, talk to your doctor, and read the facts, check the sources, get the information.
Great. And I'm sure that underlying everything you've just said, and Will, I'm sure you found that to be true as well. People with diabetes and other, you should be first in line to be getting vaccinated. You're the ones that are at so much risk. Well, Will, as we close out our show and you look straight at the camera and talk to other Black men out there, what is your final message to your brothers out there in the community?
Well, I would, of course, get them to understand that it's okay to ask the question, what should I do? What should I look at? It's all right to understand that there is a fear out there of understanding what goes on and how it's going to go on and how it affects you. And it's all right to go to your doctor, your physician, the CDC, to ask those questions of what kind of health am I in? Simple questions like, if I've had COVID, should I still get the shot or not? Should I do those different things? So you have more information, more ammunition to understand that everybody's body is a little bit different and COVID attacks in different ways. and make sure that you are protecting your family and the families around you, because it's a community piece. It's not just for your own well-being, it's for the well-being of others. And the more you can do, the better you'll understand that we can get back to being a little more normal, a little more understanding, and also just make ourselves be the best person we can be for our community.
Well, I'll tell you, as we end this show, there have been some high-profile people who, for whatever reason, have made this fight much more difficult. But thank gosh, we've got people like Chris and Will and Ron and all of the people from NFL Alumni Health who have been just absolutely extraordinarily praiseworthy in your leadership and your willingness to come and talk to other people honestly and truthfully. And so we just cannot thank you enough. Well, ladies and gentlemen, we appreciate you joining us tonight for this conversation. On behalf of my colleagues at the Ad Council, the COVID Collaborative, the Joy Collective, the Choose Healthy Life, and the NFL Alumni Health, we really want to thank you for joining us. And let me give my special appreciation to Doctors Purnell and Duke for their expertise. Folks, this is the holiday season. Let's don't give the gift of COVID. Let's give the gift of life. Get vaccinated. If you've already been vaccinated, get your booster. Let's get our kids vaccinated. But if you are one of those few people out there who are just dug in and who just refuse to be vaccinated, then just do all of us a favor. Wear your mask wherever you go. Please do not kill inadvertently the people that you are around. Happy holidays. Let's do the right thing. Take care.